Just wing it.
There we go. There we go. Thanks for joining us. Prosthodontist Dr. Matthew Naraki and periodontist Dr. Richard Agel of Jacksonville Dental Specialists have been supporting Jacksonville residents with simplified yet safe solutions for complex dental issues. Their specialty credentials allow them to provide patients with technologically advanced solutions like high-bridge dental implants that create efficiency and convenience for patients without sacrificing quality or the restoration of the safety of their patient. And joining us now, Dr. Naraki, here to explain the dental truth. Teeth for a lifetime versus teeth in a day.
Right. And so teeth in a day, expedience, you know, fast treatment, fast anything, that's what we're all wanting. And so there's kind of there's questions about that. You know, what is teeth in a day, what versus, you know, other options? And the reality is teeth in a day, teeth in 24 hours in a time period, that's not a new thing. That's something that's been alive, you know, around for a long time. Dr. Ag and I have actually been involved with that going at more than 10 years ago. It all comes down to what's best for the patient. Certainly as specialists, as prosthodontists, we're looking for solutions that can fix your problems, satisfy your goals and expectations over a very long period of time. And for some of our patients, that may be 30, 40, 50 years, if not longer. And so we always want to be mindful of the quickness of treatment, the efficiencies, things like that, but we're also wanting to be mindful of the long-term outcome, the expectations, you know, how satisfied are you? So that teeth in a day versus teeth in a lifetime, we're always treating patients so that we give them a lifetime of outcome. And the reality is for some patients, we have been and we currently do and have always done teeth in a day, so to speak. This is nothing new. This is something that's been around for well over a decade now. It's just not always appropriate for everyone, and you don't want to compromise care based on a short-term outlook.
All right, so for somebody out there considering dental implant treatment, what are the top factors to evaluate?
So as implants become more known, they've been around for decades, literally for about 40, 50, if not longer years. But the things to consider is this is a device that's being permanently implanted into your body. It's not like going in to have an oil change where the expectations is it lasts a few months, then you redo it and it should be quick and easy. This is an implant. This is something that's implanted and fused into your bone for a lifetime. So it's very important that you line yourself with specialists that have formal training beyond just a weekend course. Are they using products and materials that are reputable, that use their own research? Are they just piggybacking? Are they, so to speak, generic brand or copy milled? Are they just being replicated? What type of teeth or prosthetic are you getting? What's the plan of the prosthodontist? Is it being outsourced out of the country, or is it like us at Jacksonville Dental Specialists where everything is made here in the United States, all the implants, everything? So you want to be mindful of that, as well as the experience and training of your doctors. As specialists, this is what we do all day, every day, not just occasionally. We work on about, in 1 week, on the number of implants, what most accomplished dentists might do in a year or a lifetime. That's the difference. That's the experience. That's the expertise and training.
You mentioned something there comparing to an oil change. And a lot of times when we want to get our oil change, we want to do it quick.
Right.
You know, the fastest one they can get it done, that's what we want to do. But sometimes speed in dentistry can jeopardize potential outcome.
That's exactly right. There are certain times in services industries where speed is the main factor. You know, how fast can you get the tires on in a reasonable quality? But with this, everyone's different. Every person's different. We're not the same. We have different goals and expectations. So for someone that is very time conscious, in the case where your outcome aligns it, we can sometimes develop solutions that are very quick. Sometimes that same day you get your teeth, or we get you in some type of transitionary set of teeth. For other people where there's much bigger problems or there's a different set of parameters going on, sometimes a more staged approach is doing. So treatment needs to be custom tailored to you, the individual. We're not all the same size. It's not one size fits all. And so not everyone walking in the door can be teeth in just 1 day or 24 hours or something like that. We have to look at the long-term goals, the expectations. This is something that's permanent in your body. It's dealing with your health, your well-being. It's not simply an oil change that in a couple months is going to get redone.
Well, we got a little bit of time here. The high-bridge dental, we talk about it all the time, and the researchers and stuff that you guys have at your disposal.
Yep.
You have the latest technology,
yes.
And so this is helping your patients, making it easier for them. But what is this high-bridge HDX?
It is. It's as specialists, as a prosthodontist, we're certainly at the tip of the spears, so to speak, in the dental community, and that relates to technology and protocols and processes, and this is no different. And so one of the ways we're able to advance this is continuing the process of getting truly in that digital format. So I'm continually trying to eliminate a lot of the impressions and the gunk and the things. We're not totally there yet, but this is a process that is really bringing this into a digital format, and so it makes things quicker, easier on you, the patient. It's not as stressful, it's not as time demanding. So it's allowing us to continue that high level of expectation, but continuing to shrink the amount of time. Again, there's some people that you get your teeth the exact same day of the surgery. There's some people who are at stage, but this is allowing us to bridge that gap, and it's another way to help people.
You guys always have the best technology and make things so patient-centered. Another thing you guys do that's great is your seminar.
Yeah, that's wonderful, and it's really helpful if you're, as a patient, are more educated with what's going on, what are options, what is the latest and greatest, and what can be done in dentistry. You can make a more informed decision and feel comfortable about it, and that's going to allow you to progress through. So the seminar is wonderful. Our next one is Wednesday, May 17th at 6:30 p.m., where we'll talk about all tooth replacement options, implants, and certainly a host of other things that we're able to help you out with.
Appreciate you being here. Thanks for
you.
joining us. And we'd like to thank Jacksonville Dental Specialists for making today's segment possible. And you can call 904-460-4201 today to schedule a consultation, or you can visit their website to learn more. It's jacksonvilledentalspecialists.com. All right, folks, after the break,